I was so fortunate that my dad believed so much in education. So he went to the bishop and got a special letter to allow me to study in the boys' school. So I was the only girl in that boys' school. Had that not happened, I wouldn't be here. But according to the patients, they are expecting a man. If they are going to be seen by a woman, let it be a woman with size. But a woman who looks like a P3 or P4. So I had incidences where I would try to help a woman and she would say, "You child, get off me. Just find a doctor." They would prefer nurses.
Yet you are a doctor.
If the patients don't accept you, I used to try and put on the highest shoe you can find. But when you are a size 8 or, you are still a size 8.
Yeah.
People used to refuse me to touch their children. I actually went home crying. I said, "Can you believe what he said? He said, I'm untrainable and I'm unretainable." I've never forgotten those 2 words. And I said, I'm going to prove him wrong, even if it means dying doing so. So what was meant to be a blocker, I took it and I used it to fight the system. So I returned as the first woman epidemiologist
in Uganda.
And the first aviation medicine, qualified medicine doctor in Uganda. And that was in 1987. How can you apply? You are a Ugandan. I said, if you don't want a Ugandan to apply, record the advert and say Ugandans can't apply. Of course they don't record the advert.
They can't.
I went to England. I sat an international interview and I got the job. I returned with an appointment from Her Majesty's Secret Service, a British appointment. But because I refused to take injustice, I thought I could do it. I was sure I could do it. I told them, if you find somebody better than me, I will concede. But I knew they couldn't find. When you are a couple, God blesses you as a couple. Doesn't bless the woman and the man separately. So if the blessings have come from a man, that's God's blessings. You enjoy them and take them and multiply them, and you are a good custodian of those blessings. But if the blessings come through the woman, the man should support. Because God is not really looking at you separately. Having united you as a couple, He's blessing you as a couple. And unless, except of course there are some people who think, oh, I'm the one achieving this. It's not about you. It's blessing. It's grace. I mean, what did you do to be different than the other one? For you to have a good retirement, you need to have planned it with your first salary. I think we take ourselves too seriously.
Yeah.
We overrate ourselves. Like you could take a day off and the world won't crash. But we learn those things as we get older, and thank God I'm still able to do that. But some people learn it when they are already too old, too sick, too poor, No, but just relax, You can't. You are not the Alpha and the Omega. We know who is the Alpha and the Omega.
Yes.
The rest of us are just
Preach it, Dr. J. Welcome to today's episode where we are talking about breaking barriers. This is a common statement on the streets. Many people usually talk about breaking barriers, breaking cycles. But today I have a woman whose life is evidence that you can break any barrier in your career life, in your life as an individual, in fulfilling that thing that God has created you to do. There are many things that barriers means that there's a limitation. A barrier means that there's a mindset that sometimes can limit you. There's a state you can be in that can limit you. So breaking through all those barriers to be the person that God has called you to be, I think calls for a form of intentionality. And today I'm very privileged to host Dr. Jane Kengeya, who is a retired medical doctor. Not retired, but changed tires. She just changed tires like this and got into another profession. This woman has over 40 years in medical profession, and she's going to tell us more about who she is. But I want you to put your hands together and your hearts warmly to welcome Dr. Jane. You're very welcome, ma'am.
Thank you. Thank you so much.
How are you?
I'm fine. Thank you. How are you? I'm so happy to be here.
Me too. I'm so
really
happy
privileged to be here. Yes.
I'm so happy to host you.
Yes. And the topic is very, very close to my heart.
Yes.
Because with barriers or obstacles or challenges, you either break them or they break you.
Yes.
There seems to be no middle way.
Yes.
You know. So I'm so happy that this show is focusing on breaking them.
Yes.
Because when you break them, then they can't
limit you.
Yes, they can't limit you.
Yes.
So as you have heard, my name is Dr. Jane Kengeya Kayondo. Obviously, as you can see, I'm a woman. I'm not a young one, but I'm aging gracefully. Yes. I'm a mother.
Yes.
Of 4 adult children. I am a grandmother of 3 children, 2 of whom are nearly teenagers, and one who is still little. I'm a wife. I've been married for 43 years now.
43?
Yes. Wow. 43 years now. So I really have kind of a long journey. A long history.
Yeah.
But maybe to start it off, when you hear these stories from barefoot to shoes, from simple backgrounds to success, I think I'm one of those.
Yeah.
Yes. Because I was born in a village, typical village, deep where you think the world stops. In Nyawina, it's a village in Shema district. You go as far as you can go, very close to some hills. So for us, we thought the world stopped there.
Yes.
But somehow, I think one of the first barriers I was helped to break, because our primary school used to end at grade 4, P4 for girls.
Okay.
Only boys could progress on to P6, sit the P6 exam and go on to secondary school. So for girls, in the whole area there in our village,
they stopped
at P4.
Yeah.
That was end of story, education done. I was so fortunate that my dad believed so much in education. So he went to the bishop and got a special letter to allow me to study in the boys' school. So I was the only girl in that boys' school.
Can you imagine?
Yes.
Yeah. These are stories we don't hear.
Yes.
Like it is so unique now.
Yes.
Yeah.
I was a girl in a boys' school, the first one. Of course, eventually now the school became both sexes can. It changed. But that was the first barrier, because had that not happened, I wouldn't be here. Nothing else would have worked. So I am forever grateful to my dad for that step he took. It wasn't easy. It caused some problems after the exams. How did a girl end up in a boys' school? But by God's grace, he had got the letter.
Yeah.
That was the first barrier I broke. Then, of course, I went on to junior school. And now, in junior school, just when we were finishing so combined P7 and P8. That's when they abolished junior school. We did the exam together, P7 and P8.
There was ever P8 in Uganda?
There was junior 2, which was like P8. Yes.
Okay.
Yes. But that time they wanted to abolish that level of education, so we did the exam together. I don't know why, but I think maybe my dad hadn't finished the fees. So after we finished the exams, the sisters said, you have to stay. They didn't explain to me why, but it turned out that was the best thing that could have happened to me again in my life.
Yeah.
Because they were running a small dispensary. So I was living with them in the convent, a small room in some corner in the convent. And these were Bazungu sisters. So it was like, wow. And they had this big library, and they allowed me to start reading from their library. I had never owned a book or, I started a reading culture from that time.
Yeah.
Then what I was supposed to do was sit at a desk and register the patients as they came in. So the patients would come, I would register who's the birthday, what, the name, the age, and I would send them off to the nurse. One of the nurses was Ugandan, the other one was Mzungu. They would come back, and even then I was only 13, but they would call me Musao, doctor.
Yeah.
And they would ask me, I didn't understand what they said. Can you please explain to me? And in a very short time, I learned, and somehow that was how I ended up
in medicine,
wanting to be a doctor. I just felt like maybe, and I'm sure it was God's calling. Yes. So that holiday, that exposure, that experience, I decided I was going to be a doctor. And people would tease me, no, you can be a nurse. I would get very angry. No, not a nurse.
A doctor.
A doctor. I had never seen a doctor. I had never been treated by one. I didn't know anybody who was a doctor except one of my older brothers was a medical assistant. But I didn't know an actual doctor. So I think that was, again, God breaking a barrier.
Yes, for you.
Yes, breaking a barrier for me. So then on into secondary school, I won a scholarship. So I got 2 scholarships, the local government scholarship, and I got also a scholarship from the Meta Foundation. The Meta family, this big Meta family.
The current one, the Meta?
Yeah.
They've been there since that time.
Yeah. They used to give scholarships to some of Uganda's brightest but needy students.
Wow.
And it was a full scholarship. So secondary school was taken care of.
Yes.
Between my local government scholarship and the Meta Foundation scholarship. And that was a big barrier lifted.
Yeah.
Again, I'm sure it goes God's hand.
Yes.
Because we were quite a number of us. And at that time, I was in secondary school. My brother was in secondary school. My other brother was in secondary school. It would have been really, really hard. But at least that barrier was broken for me.
Yeah.
And, every time I want to help a child with education fees, and I done that in my life quite severally, I always think what a relief it is, what doors it opens for the child, yes, because for the child, for the parents. So for me, that was really, really something that God did for me, that I'm forever grateful. Fast forward A-level. A-level is always short, nothing really. Then university. So in the university, like we were 110, I think.
The whole university?
The medical school.
Medical school, yeah.
But to enter medical school, it was the only medical school at that time in the country. But it also took students from Nigeria, from Ghana, from some countries in Southern Africa. So we were not just Ugandans. We were mixed with
Yes.
other countries.
Which year are we talking about?
1973. That's when I entered.
Wow.
Were you there?
Even my parents were not born. I really take this as an honor to hear such a story. Yes, ma'am.
Yes. So 1973 is when I entered medical school.
Yeah.
Out of the 110, we were 11 girls.
Yes.
You can imagine. So one out of each 10 students was a girl. That is also something really,
big.
Yeah, something really big. To be able to survive and compete. The lecturers were mainly men, with just a few rare women. So it wasn't so easy. But again, I think that's one barrier that I managed to break. I did very well at med school, except, of course, one obstacle. I was so tiny, Now you see me so big.
Yes.
But according to the patients, they are expecting a man. If they are going to be seen by a woman, let it be a woman with size. But a woman who looks like a P3 or P4 child was really strange. The patients didn't even like me at all.
Because of how you
Because
looked.
of how, So actually presentation, and since then I believe that presentation matters a lot. So I had incidences where I would try to help a woman and she would say, "You child, get off me. Just find a doctor." They would prefer nurses.
Yet you are a doctor.
Yet I was either fully training medical students or even when we finished and we were doing internship. So I think that kind of
victimization,
turned me off clinical work, because if the patients don't accept you, I used to try and put on the highest shoe you can find, but when you are a size 8 or you are still a size 8.
Yes.
So that didn't go down well, but sometime during the training, I got exposure to the fact that many of the diseases can be prevented. I hadn't realized that. Actually there are ways of preventing the diseases, so that what we see in the hospital is sometimes it's absolutely unnecessary.
Yeah.
Yes. What kills people is sometimes just because the prevention didn't happen. So once we trained in prevention, and also I was having this difficulty with sick patients, my heart started to say, maybe that's where God is guiding you. And I used to pray about it, because I used to think that, now what sort of doctor am I going to make
if patients
are not accepting me? So straight after internship, I didn't get into clinical work. I ended up at the Uganda Virus Research Institute in Entebbe. That's how I became an Entebbe person since then. So I joined as a junior researcher, or a researcher in training. But those were also very tough days. There was no research money. There was nothing.
So just to cut you short, the way people made you feel actually made you discover another way in medicine.
Yes. So that was going to be my message. Don't feel stuck in one way which isn't working for you. And many people just allow themselves to get stuck. Whatever you are stuck with, there's another way
to do it.
Yes. Yeah. There's always another option. There's always another door. Yes. And so for me, I could have, I don't know, maybe forced it and whatever.
And then you're frustrated that people are not accepting me.
I was already frustrated, People used to refuse me to touch their children. So now this opened another door for me. I can't say that I'm the one who actually won that challenge, but God is there.
Yes.
God knows what you're going to be, what you're going to become. So I ended up at the Uganda Virus Research Institute. I had started kind of dating my husband before I went to the institute, but when I got there, somehow we now connected very nicely. So I was there only like 4 months, and I got pregnant. The director was not impressed at all. And this is why we don't want to employ women. You bring them, want them to be researchers, and then they start getting pregnant. He actually wrote in my personal file, untrainable and unretainable. He was very disappointed that I didn't even last 6 months. It was like, how are you going to become a researcher
if you're pregnant?
when already you're pregnant in the first 6 months?
That's so funny.
I actually went home crying. Then we were not yet officially married, but we were already living together. I said, can you believe what he said? He said, I'm untrainable and I'm unretainable. I've never forgotten those 2 words. And I said, I'm going to prove him wrong, even if it means dying doing so. So what was meant to be a blocker, I took it and I used it to fight the system. I said, why does he think that because you become a woman scientist, or you have to die without a man, without children? So the fight started then. Actually, I used to tell people that, you know what, I'm going to prove this man wrong. So I got my baby. He used to look at me in the corridor like. So I got my baby. While my baby was still little, they used to offer government scholarships to go back to the university to study public health. I went back with my baby on my back, and I did the public health, and I passed it. Now already in a very short time, I had my first degree, my medical degree. Now I had my diploma
in public
health. Actually, when I had got a scholarship, in his heart he must have said, now this time she's just going to fail. I would put my baby on my back.
Nothing limited you.
And study.
These days when people give birth, it seems like nothing is productive in them again.
I did it. Then, since there was no research money that we were busy doing research, I decided, meanwhile, let me get my training done.
Yes.
So I got a scholarship to go to the UK. That's where I did the master's in epidemiology. Wow. I left my kids. The boy was 5. The girl was 3. I went to the UK and I spent nearly 2 years. I never saw them. There was no this business of you get ticket, you come back, you see your people, you go back. I didn't see them.
2 years.
There were no phones, like these mobile phones that I could see my children on camera. We had a house phone, this one of putting the finger and rolling the units. Sometimes I would get money to call, sometimes I wouldn't get money to call. And that's when the Museveni war was on. The stuff I used to see on television. Why I didn't get a mental breakdown then, up to now I've never really understood. You can imagine you've left your family behind.
And there's war in that country.
And there's war in that country. And
all
no you're seeing on television is the war, and there's very hardly any communication. But I did it. Did it very fast. Within 1 year, I finished my master's. So as I was finishing my master's, that's when an opportunity came to do aviation medicine. Because before I left, I was already like having a side hustle, a small clinic in Entebbe, and looking after the pilots and their families
At the airport.
at the airport. But the clinic was in Entebbe town.
Mm.
So while I was there, I got this opportunity to do a certificate in aviation medicine, so that when I come back, I can grow my side hustle. So I was doing research, but I had the research wasn't paying, the government salary.
Yes.
So I was doing my side hustle, and that's where I was getting the money. Yes. So I went and studied aviation medicine. While I was there, it wasn't a long course. I think it was 7 or 8 weeks residential in a very nice military establishment. That's where we did it. Now, of course, the scholarship I was on was shoestring, when you have nothing left by the end of the week, and no matter how you square the circle.
Yes.
So now for this aviation medicine, the scholarship was £100 a day, I think. Wow. Yeah. I could have come back the way I had gone, or even worse. But because of that short time on a very good scholarship, and now I knew UK, I knew how to live cheaply. I saved so much money. I came back with a car. I brought clothes for my children, for my husband. People were asking how. God's grace.
Yes.
Yes.
He opened that door.
Yes.
And you're able to provide.
So I returned as the first woman epidemiologist
in Uganda.
And the first aviation medicine, qualified medicine doctor in Uganda. And that was in 1987. So now I had qualifications for my mainstream work, and I also had qualification for my side hustle. In fact, I tell people, side hustle is okay if you can manage it.
Yes.
But also get the skills and the knowledge and the know-how you need for that side hustle. So if you are going to have a side hustle of a shop, learn business school, a little bit of business, know how to manage business. Because I don't think it has ever been possible to survive on just one
form of income.
So I came back. I had my mainstream research already in a very short time. Now I had 3 qualifications in a very short time.
Wow.
Yeah. So that was very good. What happened, which was the most, I think, blessing I could get, that's when HIV/AIDS was starting. You were
in
hearing
Uganda.
it, yes, in Rakai, a few people, and there was so much talk and fear, but no knowledge, no research, nothing. So as I was returning, the British government and the Medical Research Council UK wanted to start a project on HIV/AIDS research in the country.
That was your window.
Yes.
Wow.
So I was only like 3 months back. A delegation came from the UK. We had negotiations. We went to the government. We went to that time there was the AIDS organization. And we ended up signing an MOU to start a big program. And guess whom God blessed to lead that big program? That was me. With so the 2 countries, the partners, Uganda would bring its leader, its head, and the British side would bring their head. So they put me together with a Dutchman. He had also done the course I did in London the year before me. So we were like at par. And that's how the MRC program at the Virus Research Institute started. Now it's huge.
It's very huge. It's a huge project.
I see it and I say, there's a God up there.
Yeah.
And now even if people don't remember, or even if people don't know, but I started that program and I ran it for 10 years. From scratch, from zero. Yes. So me and that Dutchman, we worked together for 5 years. Then he left. A British man came and worked with me. Now I'm going to tell you a story where actually I broke what do they call it? The roof ceiling.
Yeah.
So now you are both co-heading the program. He's earning 4, 5, 6 times more than you. It's the most uncomfortable situation to be doing the same job.
And one is
or
paid
even you are a
higher.
local, you are more familiar with the work, So at one point they advertised a job to head a Masaka project, which I had worked on, got the funding for. So I applied to the British government. How can you apply? You are a Ugandan. I said, if you don't want a Ugandan to apply, record the advert and say Ugandans can't apply. Of course, they don't record the advert.
They can't.
I went to England. I sat an international interview, and I got the job. Yeah. Now I'm no longer local staff.
You cannot be. You cannot be local staff. You start being an expatriate.
Now I was an expatriate in my own country.
Wow.
Yes. I returned with an appointment from Her Majesty's Secret Service, a British appointment. But because I refused to take injustice, I thought I could do it. I was sure I could do it. I told them, if you find somebody better than me, I will concede. But I knew they couldn't find.
In Uganda.
No, this was a world competition. I got the job, 2-year appointment. And now you have international status. The sky is the limit. They are renting your house, paying you rent for the home in which you live. You have...
It was big. You see, even right now saying it's really big. So I imagine then.
It was big. Yes. Because my earning just added zeros now, not even multiplied by something.
Just many zeros.
Yes.
Wow.
Yeah. So now I thought, now I'm going to settle. Who settles? But anyway, my brother gets HIV/AIDS. Those days there was no treatment, nothing. I saw him go through, till the end of his life. And that hit me hard. Because now HIV/AIDS was no longer a disease I worked on or I worked in. It was
dear to your heart.
And even now I realized even we can catch it because I was so terrified. Yeah. Every time I went to the WHO Geneva to make a presentation, we were celebrities. We were conferences, making big speeches. We were writing papers. They would ask me, do you want to join us? We will give you a good position. I said, but what position can you give me? I have an international job back home. You can't attract me with an international job. I have one already. But when my brother passed, I gave up. I gave in. So I just did 2 years of this international job and I moved to Geneva. I was lucky. I moved with my husband, with my children. They were 2 were teenagers.
So which opportunity was that in Geneva?
They gave me an employment to work as a researcher, but a senior researcher at the World Health Organization. World Health Organization is headquartered in Geneva. Yes.
That's where you were seated?
That's where I was seated. Yes. So I took the job. The advantage that came with that job, which I also had in my previous international job, was that it could pay most of the tuition fees for your children in any school of your choice. So I put my children in international school. They finished international school. They went to good universities abroad. They finished. Meanwhile, within the organization, I was also growing, reaching leadership positions and senior positions. I really had a good life, both at work, and also at home.
Mm.
Now, when the kids left home, yeah, my husband was also tired by then, you know. So we decided, you know what? Let's go
Back home.
back home.
How many years were you in Geneva?
15, 16 years. Quite a
16.
long time.
And you never came to Uganda once?
We would come. No. The way they structure it is every 2 years,
Here you come.
they buy you a ticket, you and your family, to go back home. Because we were diplomats.
Oh, yes.
We were like UN diplomats.
Mm.
So every 2 years we would come funded by the office, but then sometimes also in between we would also come. So we were never really, dislinked. But obviously you lose so much connections and all that.
So you come back after 16 years?
So I wanted to come back, but I didn't want to come back without a job. So there is a foundation. It's called the Welcome Trust. It also does research funding. They were looking for a special advisor for their African investments. I competed for that job on my knees, basically. when you combine prayer, like I needed that job because we wanted to return, and I got it. Then they said, so which country do you want to live? I looked at myself and said, is this happening? So of course I chose Uganda. So they returned us to Uganda, and as good luck would have it, the MRC program, which I had started, they asked it to be my host. Yeah. As they say, where you live without quarreling, you can come back. So they set me up a nice office, but it was a traveling job. So I was in and out. But again, the message I want to send to people here, what another person can do, you can do. Because sometimes we see people with these UN jobs, we see people working in international jobs, and you think that's not for me. It can be for you. There's nothing special about people who get these jobs. I think it's a question of sticking out your neck and making sure that you get advice where you need to get advice, that you also have to make sure that you have the right qualifications, the right mindset. Because when they are interviewing you, they are not just looking for your technical competence. They are also looking whether you have leadership potential, whether you can work well as a team, whether you are emotionally stable, whether you will be able to adjust to a culture difference. You see, whether you have a stable family, whether you are mentally stable. All those are not, technical things. Those are the soft parts. So don't decide for yourself that that's not for me. Give it a go. Yes, give it a go. And if you prepare well and you get the help you need, you can get these jobs. People who get them are just like the me and you, nothing special. Nothing really special. So when I returned, it was a traveling job most of the time. So I would spend 2 months in London minimum, and then the other months all over Africa, Europe, South Africa. It was really good in that way. I learned so much in a very short time. Now different than what I was doing in Geneva. But eventually everything has an end. Yes. So I retired in 2018. Before I retired, I knew what I wanted to retire into. Because all along I had seen this gap in soft skills. When they gave me the opportunity to start the big MRC program, I realized nobody had ever trained me in leadership, in management, in negotiation, in handling people, handling staff, in communication. I was green on
Yet
that
you
side.
had your
Yet I
papers.
had all my papers, my degrees. I was solid. In fact, a lot of the pain I suffered trying to start that program was because I was not ready on that side of the skills. So I realized all the way back then that the education we get, sometimes we are half-baked. In fact, most of the time we are half-baked in that side of the skills. Did I do the job? Of course I did the job. Could I have done it better? I'm sure I could have done it better if I had those skills right from the word go. Did I learn some of those skills? Of course I did. But you know, when the classroom of life, as they say, it gives you the exam and then it gives you the lesson. So you learn by mistakes. You know, I made some mistakes. I learned through try and error. And even back then I thought, you know, maybe this is something
you want to do once you're out of your formal employment.
Yes. And then, of course, as I interacted with people all over the world during my WHO time, I could see the gaps, you know. I could see the gaps. You see someone, PhD and what, you actually want them to get the job, but they can't.
They can't talk.
They can't express themselves. You look through their CV, you don't see anything else apart from PhD, but you are looking beyond a PhD. You're looking at somebody who can lead, who can, you know.
I think that's something that as younger people we need to learn earlier.
Yes.
That it's not just the paper.
It's
but
not just the
it's
paper.
more than that. Your management level, your leadership,
your communication, the way you manage your discipline, the way you interact with people, all those ones actually. As they say, the papers will get you into a job, but these days probably not, because people are looking for both sides of the coin. But to keep a job and grow into a job, you really need both skills. So that's how I have ended up.
Dr. Jenny, see, your portfolio is so rich that we cannot even summarize it. But you've done it so briefly, you know. One of the things I want to know, in your journey, you seem to be the thriving spouse, or the one who is out there doing a lot, even by the fact that, you know, your husband had to go to Geneva. I mean, many other, even the 2 years you left earlier to go and do a master's, and you left the kids with him. How was that happening, especially for him? Because increasingly women want to thrive like that, but then you also remember the balance with family, saying I can't make such decisions. Recently you find that women can't make a decision like that, especially when you have toddlers at that level. You're like, I can't leave kids here, so I can't move. How did you strike that balance, and how was it for your husband?
Yeah, so I think once we got that message of untrainable and unretainable because of a pregnancy, it was like, we are in this together. Yes. So I think from that time we realized, you know what, we are in this together. So much that maybe I'll tell something that is a bit emotional for us. Before I went to London, he lost his parents, 8 members of his family, in a brutal attack that we never figured out what was the cause. I had just gone to Nairobi to do a short course, a 3-month course. It hadn't started. It was the day we were supposed to start. Tomorrow is the night this thing happened. So I came back with all my things. I knew the training was done. I wasn't going to attend. After the funeral, he's the very person who told me, you have to go back. Can you imagine? When he was still in mourning and such a... I refused. I said, no, I'm not leaving you like this. He said, you know, go back, because you don't know what doors that
training will open.
I went back unwillingly, but he is the one who insisted that I go. So he has always had my back. You know, somebody who can do that for you. Me, I was resisting. I was refusing. I wasn't ready to go back. But he said, please go back. And the little baby was still a baby. So somehow we saw each other. and we still see each other as we are in this together. Yeah. If you're lucky and you get that type of husband, I think it's God also. God must be in such things.
Yes.
That you get a man like that. So we, taking children to school. Before we left, he didn't know how to cook and all that. In Europe, you don't have house boy, house girl, what? He learned very quickly, and innocently and without agony or without making it an issue. And we coexisted like that. So it's also a type of man, but also it needs a type of woman, because I know women who throw their degrees all over their husbands, who rub their money all over their face, If you do that, obviously you will cause trouble. It takes a certain level of humility, but also of openness to say that at home, I'm a wife, I'm a mother, I'm a sister-in-law. In the office, I may be a boss, but I can't carry that bossiness at home. I think many women who carry that bossiness
I've had it rough
at home, yeah, the men won't take it, and the women won't be happy as well. So it needs to realize, and me, I believe that, and I say this with a clear mind, when you are a couple, God blesses you as a couple, doesn't bless the woman and the man separately. So if the blessings have come from a man, that's God's blessings. You enjoy them and take them and multiply them, and you are a good custodian of those blessings. But if the blessings come through the woman, the man should support, because God is not really looking at you separately. Having united you as a couple, He's blessing you as a couple. Yes. So I think once one realizes that the blessings come for the couple, for the family,
it can come from
they don't
either.
have X and Y. They have, yes, they can come from either side. And if they come from either side, you both embrace them. So I think that also helped us.
Amazing. And for me, it's a mindset issue.
It is.
That the blessing comes as a whole on a couple.
Yes.
And that's a mind-blowing
And if people could
mindset.
understand that, I think it would dissolve a lot of the tensions.
Oh yes.
And unless, except of course there are some people who think, oh, I'm the one achieving this. It's not about you. It's blessing. It's grace. I mean, what did you do to be different than the other one? Than other people? Once you realize it's grace, it's blessing, and it comes to you as a couple, it comes to you as a family,
you embrace it.
And I don't think we preach it well enough. I think we need to have it as a theme whenever we talk to couples, whenever we prepare couples. It doesn't matter the blessings, but it comes to you as a couple.
That's very profound. And once a couple has that mindset, I think it becomes easy.
Yes.
But the challenge these days is that there's too much talk on the man, that the man must provide. If it is the woman, maybe then there's an issue.
If God wants the man to be the one, God will pass it through the man. Yes. And maybe very often He does. But that doesn't mean that God doesn't have another way.
Yes. Amazing. And in your career life, which is so rich, what has been one of the, it could be one, it could be more, one of the most fulfilling moments as a doctor?
As a health researcher, maybe I would say, because now when you say doctor, people think of clinical practice.
Oh, yes. But because the title is there, so sometimes layman, we think doctor is one who is treating patients. But really, in your medical career, what have been moments that even now at your age, you look back and you so much cherish?
So one thing I always cherish is when I see someone who is blocked, unblock. You know, things tight on them, and they ease up. So, and for doctors, that's really one of the biggest gifts that God gave us. That somebody can come in at the verge of death, and by what you've done, they can come out,
Alive.
I used to get so happy when you left a patient like this, and you come back in the morning and they are smiling at you, and they are sitting up, they are drinking. You feel, maybe in some way I have contributed to this miracle. That's some of the moments that doctors really, really, really
Treasure.
cherish. And sometimes even when you feel that it's not working, and then you come in the morning, but of course we get also the other side. You come back and the bed has been rolled up and the patient is dead. But very often we are in this, things are much better. So I used to enjoy that a lot when I still practiced, both in the hospital but also in my private clinic, that somebody comes back the following day and it's all overnight because of some of the treatment you gave. Another example I like to give is, for example, like when there's so many questions that, for example, like let's say like COVID, and I didn't work in COVID, but I'm giving it as an example because I used to work in malaria. And there's an unanswered question, like really how, like one of the questions I really engaged myself in was, is it possible to have a medicine and label it in such a way that even a village woman can understand it? Because normally the medicines, you are not supposed to kind of understand them.
Yes.
But I wanted to demystify that. Is it possible to make people understand the medicines they are taking? So I did some of the research I led was trying to do that. Can we take a new medicine and make people, I can look at it. So you know what we did? We put pictures, different age groups, to say that a baby gets this dose, a middle-aged an adult gets this dose, and then morning is sun, and at night is moon. And we would show it to the women, and they would say, and then you don't need really
explanation,
too much explanation.
Prescription.
Yes. And one time I was passing by a clinic in Entebbe. This medicine is called Coartem. It's for malaria.
We know it. All of us who have grown up in Uganda.
I was one of those who contributed. I led the research which labeled that Coartem the way it is labeled now.
Wow.
Yes. Yeah. I felt so good. I said, every time I pass by it and the moon is there, and but now, of course, sometimes they don't always label it the right way. They put it in the old packets. But the way WHO had approved it, that because then people understand the dose for the child is not mixed with the dose for adult. Then we used to recommend that it is sealed in such a way that you can't open it easily and you can't break it. So that was really, really
a good
very
moment.
Satisfying for me to see that. And then, of course, some of the stories, you find people, they have research money, but they are stuck with it. Do you know there's so much, some of the research money. And then you work with the team, and all of a sudden that the work on the ground starts going, the money starts getting spent, the research starts coming out at the end, and you feel that because I came and I interacted with this team. I worked with
There was
this.
progress.
There's progress, there's outcome, there's impact. Everyone is now feeling, and yet they were stuck. And sometimes some of the stuckness or stickiness is not major things. It's just logistical support. It's just making sure that the leadership is right, that the reporting is good, that the field teams are trained, that the field teams are. And every time I did that, I would be so
good. Amazing.
So happy.
Amazing. Thank you, Dr. Jane. I mean, we can go on and on in experiences, but one of the things I want us to talk about, even as we bring this to a close, is the life that you lived is a dream life for many people who are in their profession. To rise to that kind of level, where an expatriate, where on top of management, where the highest organization. I mean, who doesn't want to work with World Health Organization? Even if you're part of a project there, but for you are part of their top executives, after living all that life, and I'm asking this for the sake of people who aspire to live it. Do you have any regrets? Are there things you wished you knew then that you know now? For somebody who is younger to kind of have their vision a little bit directed better.
Because there's always an end to everything.
Yes.
So I think even as you start work and all that, you know that one day the work will end. So for me, and I say this in honesty,
yes,
start planning for the exit at the entry door. Don't wait, because many people say, let me, live carelessly and do whatever. When I get older, that's when I will take care. Maybe when the gray hair comes, or maybe when I retire, For you to have a good retirement, you need to have planned it with your first salary. And nobody taught me that. But somehow I managed to be careful and invest a little and, But I think to have a good older life, you need to work for it in younger life. In Uganda, actually, they have a good proverb, something like, it's the younger brain which works for the what? For the older brain. So my advice is, don't think that as I get older, as I get richer, as I get more jobs, that's when I will start planning for my future. If you can save 1,000, can you imagine if I had been saving like 10, like even $1,000 a month for all that time? But nobody had told me these things of saving, of investing. No one had taught me. So that's why I want people actually to learn those things early. Plan now for the future. Invest as you go along for the future. Learn to live within your means now.
Emphasize that one.
Yes, and then retirement won't be so hard because you will already know how to live within your means. I think it's this delay to plan for your future that I want to give the message to people. Today start. Your tomorrow will be better. Today study more. Your tomorrow will be better. Today try and live a decent, good life. Your tomorrow will be better. Because we have this habit of next tomorrow, next year, is when I get this, when I get this. You get too late. Yeah, you get too late. And another thing I would actually change if I could go back, we used to travel so much for work. I would come, check into a hotel, following day go to the conference, in the evening pack my bags, go to the airport and leave. So you've actually been into a country, you haven't seen its people, you haven't seen its culture, you haven't even looked around at all, I don't do it anymore now if I get a chance to travel.
Mm.
So if you are in those jobs which make you go even to Kapchorwa, to Mundibujo, to Kasese, to Fort Potro, don't just go into the hotel and then come back. Look around, visit a nearby school, visit a nearby hospital, see what's happening in the community. It enriches your experience. And those are the advantages of jobs that are extra, but we don't really take advantage of them. So that be curious, learn. Don't just travel for work and come back and you don't even know anything about the city.
Yeah.
So for me, that's one thing I would change if I could go back.
Amazing. To have enjoy your life when you're younger. If you go to a place, interact with people. Live, don't be so
so uptight in your work and or if you get 1 minute, you go quickly shop, you come back. No, find out before you go. Prepare, read about what are those 3 things I can see in this city that will teach me something. Yes, and if it means adding an extra day before you travel back, add the extra day. But just enjoy the experience.
Enjoy your life.
I don't think I enjoyed it much. I would just concentrate on work.
And now you wish to have it.
Now I have so many countries and cities which I claim I have been to, but I don't have much knowledge of them because I never took the time to look around or to learn anything.
Interact with people.
Yes.
Amazing. I've interacted with many people of your age, and usually their experience of life is easy. Like, they're not so hard on themselves, and they wish we were like that.
It's a lesson you learn with age. I think we take ourselves too seriously.
Yeah.
We overrate ourselves. Like, you could take a day off and the world won't crash.
Oh, yes.
You could go out and laugh.
You tell these guys.
Yeah.
They work Monday to Monday.
No, you will crash. Take a day off. Go party. Go celebrate.
Go to the beach.
Yes, be happy. Enjoy life. But we learn those things as we get older, and thank God I'm still able to do that. But some people learn it when they are already too old, too sick, too poor, No, but just relax. You can't. You are not the Alpha and the Omega. We know who is the Alpha and the Omega.
Yes.
The rest of us are just
preach it, Dr. Jane. That's a very good point.
Yeah, have fun. Yeah,
that's good. That's good. What are your last remarks as we bring this to a close? Any message to young people?
So any message I think I can give right now relates to the work I'm doing.
Yes.
And I mentioned this earlier. Don't be satisfied with just the degree, the diploma, the certificate, the professional skills, the hard skills. Find every avenue to learn the soft skills.
Yes.
How you communicate, how you self-discipline, how you interact with people, how you manage your emotions, how you lead yourself. The two have to match together for you to have a successful life. So I run this company. It's called Rounding Up the Ages. We focus on soft skills for employability, for business, and for life. We have programs for secondary schools. So if you are a head teacher of a secondary school, because there are so many things that the school necessarily can't tackle.
Yes, it's not on their curriculum.
It's not on their curriculum, but a company like this can tackle. We have programs for universities. So if you are linked up with your university or you are a university head, reach out to us because we can bring in those elements in the education curriculum that you don't have in the curriculum. We have a very big program with workforces, so people like your young people here. There's that gap also with soft skills. We try to fill that gap, and that's working quite well. And then we also invite professionals. If you feel like you want to add these soft skills onto what you already have, some of them are looking for a promotion, they are looking for a better life, their relationships or whatever. We also have programs for those. So I would encourage everyone to try and see to balance that skill set,
Yeah.
so that you are not working on one side only.
Amazing.
Yeah.
Thank you very much, Dr. Jane. I've been super challenged, inspired, really. I think that's the word. For me, I mean, hearing your story, you see a woman that has risen far above the places you desire to go to. We come from those backgrounds, but knowing that that should not define who you are, I think that's an incredible lesson. But also hearing how you took up many things for the first time. You know, you fear to be the first person to do something. You're like, and people will talk you out of it. Like,
Yes.
like who does that? Why would you be in a school for boys yet you're a girl? Many women moved on, got married, and now they didn't turn out to be anything in the country. But hearing how you defied those, seeing possibility that, you know, I can do this. I know I might not have an example, but I think it's possible. That's what God can do in our man. So thank you very much for sharing your story.
It's my big pleasure.
I
always say I am one of God's favorites.
Oh, yes, you are. Yes, you are. I mean, thank you. I'm also very privileged to have sat down with you today. So thank you very much, everybody that has listened to us. If this is a conversation that you felt very inspirational, please go in our comment section and let us know what that one thing that stood out for you. Okay? This year, I'm not leaving this show without telling you to subscribe. I'm not leaving you to settle. And for that, I'm going to give you 1 second to subscribe. Thank you very much. Thank you so much. So till next time, bye-bye.